We are back with Dr. Evelyn Lomasney with Cone Health Allergy and Asthma Center of North Carolina. We're talking all things spring allergies and symptoms. So let's continue the conversation. At what point should someone consider seeing a healthcare provider to get relief for their allergies versus just taking the over-the-counter meds?
So I use a lot of over-the-counter meds in treatment for patients, and I would argue at any point if they want more information or options to reduce medicine use. In general, though, if they're taking, an antihistamine every day and it's not enough, I would say go seek your healthcare provider because we've got other options. You don't need to be suffering out there.
Okay. I'm sure that there are some symptoms that are red flags that we need to seek immediate medical attention for. So what are those red flags, and then what kind of attention? Where do we need to go?
Sure. The big one we worry about with environmental allergies is asthma-like symptoms. So if you're outside and it's a high pollen day and all of a sudden you're coughing or wheezing or short of breath or have chest tightness, that should be, you should go seek healthcare. And I would argue it kind of depends on how severe it is. Really severe symptoms, if you're having a hard time breathing, then you're going to urgent care or the ER to get treatment for that. If it's more mild and subtle, I would start with your primary care or come see an allergist. And we definitely worry about those asthma-like symptoms probably the most.
Okay. We hear about allergy shots and people on allergy shots all the time. At what point should someone consider allergy shots, and then how do they work?
Sure. So I tell people there are three things an allergist can do: tell you what you're allergic to and how to avoid it, make recommendations for medicines to try and prevent you from having symptoms, but really that allergic reaction is still going in the background. And the third is allergy shots, or what we call immunotherapy. And with that, what we do is we give you targeted doses of what you're actually allergic to at targeted intervals to retrain your immune system. So instead of going outside and recognizing pollen in an allergic way, we make you non-allergic to it. So it can be a cure. And who really do I recommend shots for? Anyone who wants to reduce lifetime use of medication, so it's always an option. Anyone who's having side effects from the medicines, or they're not enough, they're not working. Anyone who it's causing their asthma to flare or bad allergic skin disease. And anyone actually with animal allergy, an animal in the house, if they're allergic to their pet. That's a tough one. That is one where we recommend allergy shots because they're fighting an uphill battle.
All right. What happens if we're not allergic to our pet, but our pet is probably making us feel bad because they're bringing the pollen into our house?
Yes, that definitely is a thing. Just like we were talking about those avoidance measures you can do for your clothing and yourself, apply them to your pets because they're going to bring that pollen in from outside and put it all around your house. So more frequent pet washing can be helpful to get rid of that pollen. Or same idea, maybe don't have them go out in the early morning. Unfortunately, like that's dog walking time, right? But that's also where the pollen counts are the highest.
I kind of told you that I feel like really foggy when I take my medicine, and then you suggested, if one doesn't work, you should do another. But my next question is, should you take it at night versus in the morning, or does it not matter?
So great question. There are some that actually probably work better taking at night. And there's some that it doesn't really matter. You want to take a 24-hour one. So those are the newer ones, not like tried and true Benadryl. And those you can take at night if they're making you sleepy, and it will still give you relief throughout the day.
Okay.
So it doesn't matter, but if it's making you sleepy, try taking it at night.
Okay. And are allergies hereditary like other things?
Yes, so there's a big genetic component to allergic disease. It's not always a one-to-one, like you have seasonal allergies, so your kids will, but the tendency towards allergic disease runs in families. So there's a big genetic component. So yeah, in our practice, we see whole families because everyone has allergies.
Gotcha. All right, we got a little bit less than a minute. What kind of final thoughts do you want to leave us with when it comes to allergies and symptoms and treating it?
We have a lot of treatment options. So my biggest thing is you don't need to suffer out there. A lot of people think, oh, it's allergies, I'll just suffer through these few months and then I'll be fine. So don't hesitate to reach out to your doctor or come see an allergist. You don't really need to suffer, and don't underestimate allergies. They can make you pretty miserable. And so for kids, school performance and things like that, People have to call out sick, people get sinus infections. We really can get you to the point where that's not happening anymore. So yeah, don't hesitate to reach out.
All right, sounds good. Thank you for your time and your expertise. And if you missed any of this, maybe you need to send it to a family member or a loved one who deals with allergies. We're going to have this in the To Your Well-Being section of our website. Right now, we're going to take a look at the forecast and maybe the pollen count, Tim.